Heather, you've used nearly all the drugstore medications without much success. So, I'd like to prescribe a Triptan medication for you to take with your next 3 headaches. Now, Triptans act directly on the nerves and the blood vessels to stop some of the mechanisms that cause headache. And while any drug can have side effects, they aren't common with this medicine. Triptans don't cause drowsiness, and they're usually very well tolerated. So, I'm hopeful that you'll feel better and be able to function well after taking this medicine. Now, Triptans come in several formulations. You've got tablets, nasal sprays, wafers that dissolve in your tongue, and an injection. Do you have any preference?
Let's go with the pills.
Most people start with the pills. I'll give you a prescription, and I'd like you to take it for 3 headache attacks. Now, it's important that you take them as soon as your typical bad headache begins. Triptans are effective for even severe headaches, but they work best and are most likely to get rid of the headache completely if you take them early. I know it's hard when you've got small children, but when you use a Triptan, try to find 5 or 10 minutes to use an ice pack, lie down if you can, relax, or eat or drink something if you feel like it. Just making an effort to do these things can really help make the medicine work.
How often can I take the Triptan?
Good question. Triptans are meant to treat individual headache attacks, so I don't recommend taking them more than 2 days a week. So just start with 1 tablet early in the headache. If your headache isn't completely gone 2 hours later, you can take another tablet. Just don't take more than 2 tablets in 24 hours. I'm also going to prescribe an anti-inflammatory medication called an NSAID. If after treating 2 headaches you find that the Triptan by itself doesn't work well enough, I'd like you to take the NSAID along with your first dose of the Triptan on the 3rd headache.
I sure hope it works better than the other things I've tried.
Well, I think there's a good chance that it will. But nothing works all the time, and you should have a rescue treatment to use when the headache gets away from you and is really bad. Now, this can prevent a trip to the emergency room. When a migraine doesn't respond to treatment and becomes severe, you may get nauseous or even vomit. And even if you do keep the oral drug down, it may not be well absorbed. That's why I recommend that you use a rescue treatment, a rectal suppository. Now, the medicine I typically use should stop any nausea or vomiting and will probably make you drowsy as well. Now, if you can sleep, the headache should be better when you wake up. So I'll see you after you've treated 3 headaches, or in 2 months, whichever comes first, and then we'll evaluate the plan and rework it if necessary.
Okay. Thanks, Doctor.